Hi, my name is Dr. Sheryl Jawetz from Tenafly Pediatrics. In this video, we will be discussing how to train your infant to sleep through the night. Many parents ask, when can we start sleep training? We advise that sleep training begin at about 3 months of age when the baby is approximately 11 to 12 pounds. There are several important points in this process. First, the baby should be put to sleep at the start of the night when she is sleepy but still awake, and she should be aware that you are putting her in her crib and leaving the room. If she cries or fusses, you should see if she can settle herself to sleep on her own. After about 5 minutes, you will probably hear her stop fussing periodically and being quiet for longer and longer periods of time. If after about 5 minutes she does not settle at all, you can go into the room to comfort her. But we recommend that you try to only use your voice to do so, or gently pat her head or her belly to comfort her until she stops fussing. Most importantly, do not pick her up out of the crib, and do not stay in the room longer than you were out. Repeat this process for progressively longer periods of time as you're waiting for the baby to settle herself to sleep. We generally recommend doubling the amount of time that you were out, going from 5 to 10 to 20 and then 40 minutes. By the 20-minute period, however, most babies have settled themselves back down to sleep. This process can be repeated through all the nighttime wakenings. However, it has been shown that if at the initial time the baby is put to sleep in this manner, there often are fewer nighttime wakenings. And overall, it should take approximately 1 or maybe 2 weeks to have significantly improved nighttime sleep. At this point, I would like to focus on 2 additional aspects of sleep training. The first is consistency. Once you start sleep training, stick with it, and everyone who is involved must participate. Even a young baby, an infant as young as 3 months old, can learn very quickly that if mommy doesn't respond to fussing and crying, but daddy does, then he will just keep crying until daddy comes in. In this regard, while I said initially that sleep training can begin at 3 months old, you should not start until you are ready to see it through. However, it is recommended to begin the process by 8 to 9 months of age, because at that time, cognitive developmental milestones are reached that will make sleep training increasingly difficult. The second and perhaps most important point for any parent of a new baby is, do not feel bad when the baby cries and fusses for short periods of time. This process teaches a baby to self-soothe, a very important skill that he or she will need for the rest of their lives. By sleep training in this manner, going in and out and comforting periodically, you also should not feel that you are abandoning your baby, because he or she knows that you will be coming back in. And she will quickly learn that he or she can soothe himself to sleep and in other stressful situations. This is a start of life lessons that you will teach your child throughout his or her life. For further information about this and many other pediatric subjects, please refer to our website where we have many articles for your reference. And you can look in the After Hours section. Please feel free to call us for any further questions. Thank you.